Good evening, everyone, and welcome to the Together We Build Town Hall. Thanks to your input, the new Windsor Essex Acute Care Hospital is starting to take shape, and we are thrilled to have this opportunity to provide you with an update tonight. I'm Allison Johnson, Manager of Communications and Community Engagement for the project, and your moderator for this conversation. Before we begin, let's respectfully acknowledge that Windsor Regional Hospital and the site where the new hospital will be built occupies the traditional, ancestral, and contemporary lands of the Niswi, Ishkoden, Anishinaabe, the Three Fires Confederacy, Ojibwe, Ottawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. So on behalf of the project management team overseeing planning for the new hospital project, we're pleased to welcome everyone tonight joining us via Zoom webinar. Tonight, you'll have the opportunity to meet members of the planning team, including one of the architects working on the new hospital design, learn about the work that her team is doing, see an early draft of the drawings of the new hospital, and ask questions. The Q&A portion will take place at the end of tonight's presentation, but you are welcome to post a question anytime by clicking on the Q&A button at the bottom of your screen and typing in your question. We will do our best to answer as many questions as possible, but please note the focus of tonight's town hall is to demonstrate how your thoughts and ideas have been incorporated into the evolving design of the new hospital. So this includes items related to the physical structure of the building, where it's positioned on the site, and where the different departments and services will be located within the new building. It also includes design features and technologies that may be built into the plan. So to maintain the focus of this conversation, we do ask that you ensure your questions are related to this topic. And following tonight's conversation, we also invite you to visit our website at windsorhospitals.ca to learn more about the project and ask further questions. So I want to introduce you now to our panel guests we have with us tonight. Everyone, please say hello to Karen Riddell. She is the Chief Nursing Officer, Chief Operating Officer, and VP of Cardiology and Critical Care and Diagnostic Imaging.
Thanks, Allison. Good evening, everybody.
Dr. Andrew Petrakis is the Director of Clinical Services Planning for the new hospital project.
Hi, everyone.
Jeff Gemmel is Director of Support Services Planning for the new hospital project.
Hi, everyone.
And Dina Brown is an architect and Stantec team lead for this project.
Hi, everyone.
And thanks to all of you for joining us tonight. So a bit of background to start out with. The pace and planning for the new hospital has been increasing steadily over the past year and a half. Working on the current stage began after a visit and a funding announcement from Premier Doug Ford in October of 2021. After that, a project management team was assembled to lead planning, and 40 user groups representing all programs and services within the hospital began to work on the project. Throughout the process, these groups made up of hospital staff, professional staff, and community representatives have been working with expert planning consultants and relying on input from their colleagues and from the community. During this stage, the community was invited to visit the project engagement site where they could share ideas, attend one of 11 virtual town halls, which were held last spring, ask questions, and share priorities for the new hospital through a series of surveys. This feedback was really important, and it helped to establish a project vision and a set of design principles for the project. The guiding principles, which you will see here, are shared with the teams at the beginning of each working session and are helping to guide decision-making throughout this process. They're a constant reminder that the new Windsor Essex Acute Care Hospital is being planned for and with the community. In September, after a competitive process, Windsor Regional Hospital selected Stantec Architecture as the team of architects and engineers for the project. Since that time, Stantec has been working with the user groups to develop a set of block diagrams and a campus plan for the new hospital. And right now, I am pleased to turn things over to Dina Brown to talk more about the work that they've been doing and give us all a first look at the early draft drawings. Dina?
Great. I'm going to just share my screen. And hopefully that's showing up for everybody. So we're really appreciative of being part of this process. This is we recognize that this is an incredibly important project for the Windsor Essex community. So I'm really thankful to be here tonight. So I'll make some quick introductions and I'll talk about the objectives of what we want to get across tonight. We'll give you a bit of a campus planning update and a blocking and stacking update, and I'll make things a little bit more clear about what that actually entails as we go through. So I am one of a large team. This group of people are all behind me working on the project and on the design that you're going to see, the draft design. The individuals that you're seeing up on the screen have actually dedicated their career to healthcare planning and design. It's something that they all feel really passionate about, and they're really excited to be part of this project. There are, in addition to this is our architecture team, there are engineers, interior designers who will all be involved in the project as it moves through the process. So when I mentioned that we would talk about the campus plan is essentially a site plan. It's, if you can imagine, a bird's eye view of the site, and it really gives us a chance to kind of look at it holistically. Where are the buildings? Where's the parking? Where are streets? How do we access the site? All the major elements that comprise the master site plan. And then we're going to look at blocking and stacking. And when we talk about that, it's really a representation of where all the departments are on the within the building at each floor level, how we access the building and access each of those departments, the sort of idea of the circulation, and really start to understand all of the key adjacencies that are required. The basis for all of that is the functional program. That's what we use to determine what is the size of each of the departments to make sure that they meet the needs of the community, meet the needs of the services that are to be provided. So that's the basis for all of our drawings. Now, it's important to note that we are mid-process with all of the users. The users include healthcare providers, they include members of the community, they include people who work in materials management, housekeeping. They're giving us input on the planning as we explore that functional program and develop it in a graphic form. So we just completed our third round of user group meetings, and we'll have one more round of user group meetings to make sure that we've accepted and understood all of the input that all of these people are giving us, in order to make sure that the representation, the planning that we submit to the Ministry of Health accurately represents all of the requirements of the project. So this is still very much early stages. What you're seeing, the drawings that you're seeing today are really what we presented last week. We have more work to do in order to get to the position of having the project costed and then go to the Ministry of Health, who will then provide input, and there'll be another round of work to come on that. So I do want to make sure that everybody understands that this is very much a work in progress. So campus planning. I'm sure most of you are quite familiar with the site for the new hospital at County Road 42 and Concession Road 9. As you can see, there's not a lot of unique characteristics of the site. It's relatively flat. So that means we have to kind of consider what are all of the other impacts on how we would approach the site design. So just a few images of the site. We know that the beloved Lafferty corn stand is right here on the corner, and that's something we're obviously giving some thought to. But you can really get a sense of that quite flat site, again, with not a lot of features for us to refer to, but that's actually quite advantageous when planning a significantly sized new hospital. It's also really important to have these two major roads that allows us to get appropriate access to the site, both for visitors and staff, as well as service. So when we start to look at a site like this, we really kind of take on board diagramming. What are some of the elements that will impact how we lay out the site? We know that there's going to be improvements to County Road 42. We know that there's very likely going to be a traffic circle. We want to think about what are the views to the site? How do we make sure people can find the entrances that they're going to, find their way to various parking? How do we subdivide things like logistics traffic and staff traffic? We want to make sure that we can stream flows on the site. Where's the sun path? Where would winds be approaching the site? So these are all considerations as we start to take on board, how do we lay the hospital out on this site? So as we do that, we also want to think about how do we approach the site? Can we make sure that there are quadrants of various components of the elements that we have to accommodate on the site? So we obviously, everybody understands well that the emergency services on the site are incredibly important. So how do we make sure that ambulances can get on the site, people who are coming in for walk-in emergency services? We have a helipad. So looking at an approach where we can gather all of those elements on one portion of the site. Where are the major public entrances to the site? And looking at compartmentalizing those as well. And looking at future expansion, really important. Also, considering where all the service is. We want to make sure that we keep things like trucks away from elderly people who may be driving onto the site, and really keep that, that element of the site into one particular quadrant of the site. So this really represents how we start to break the planning down into a partie diagram, which is what we kind of call this very straightforward diagram. So I'll just, I'll zoom in a little bit on this. Hopefully this will resolve for everybody. So again, I'm just gonna show you with my cursor, this is County Road 42, this is the 9th Concession Road. And as I zoom into the site a little bit, you're starting to see the scale of the new hospital as it sits on the site. You can start to see in these gray areas parking that's been distributed around the site. One of the elements that we're considering at this time is whether or not to have a parking structure that might accommodate additional parking. And what that allows us to do is really make sure that we try to save space for the future, but also really consider green space, provide opportunities for really wonderful outdoor spaces, which is all part of a great, healthy campus plan. So given consideration to what we've just talked about, this is that emergency quadrant. You can see our helipad here, our walk-in entrance, our ambulance garage. So ambulances arriving here. That's all on this side of the site. We've got a main entrance here, and that roadway is leading to the new main entrance to the hospital, main public entrance to the hospital, with opportunities for drop-off, and I'll go into a little bit more detail on that later. We're also looking at and considering this sort of civic plaza here. We're looking at a lot of new hospitals that are providing welcoming space for the community. So, you know, here's an opportunity to continue the tradition of Lafferty's potentially on the site as well. Considering all of these potential outdoor spaces. We're also looking at a designated cancer patient entrance, as well as a cancer patient transfer entrance, a inpatient visitor entrance, and a staff entrance. So what you're seeing here in this large rectangle is the diagnostic and treatment block, what we would refer to as that. And then in the sort of more star-shaped form is where the inpatient units would be. And finally, on this part of the site here, we're looking at a loading yard. That is actually recessed down below grade. So there's a ramp down to that. There's also a central utility plant. So that just kind of gives you an overall sense of how the building is distributed on the site in the current planning. Again, there's lots of input coming in on this, and we're really making sure that we take on board all of the comments that we've received to date. So I'm going to take you through the blocking and stacking, and going to literally go from the basement level up. So as you can imagine, a lot of our support services are located in level 0. So that loading yard that I was referring to, which is recessed, comes down to this level. This is where we have all of our clean and soiled docks, and we have the lower level of our central utilities plant. We have all of our materials management on this floor. We have things like medical device reprocessing, which needs to stack with surgery and maternal services. We have our food services. We have a number of other facilities that are located on this level as well. I'll point you to, when you're seeing on these plans, you can see some different colored arrows. That helps us to designate what kind of traffic is moving through these corridors, whether it's clean, soiled, whether it's public, or whether it's back of house. So things like the green squares, those are public elevators. We don't have public coming down to this floor, but it just shows us where this comes through the stack. We also have red elevators, which are patient service, orange elevators that may be for automated guided vehicles as well. There are some gray boxes that you'll see on the plan. Those represent exit stairs. So all of this helps us to really consider what needs to stack up through the building and what is located on each floor. I'm going to move up to level 1. And first, I'm just going to show you level 1 in the context of that site plan. So hopefully this will, okay, good, it's resolving now. We just wanted to show you this relative to that site plan that I just walked through. So again, there's that main entrance courtyard that gives us a nice protected drop off. It allows people to be to get out of vehicles very close to the entrance in order to shorten up our travel distances to our public elevators and make sure that people have opportunities so that they can wait in areas with good visibility to that drop off when they're also receiving a ride. Again, this is that helipad, our ambulance area, so entrance to the ambulance here, our ED walk-in. We have Indigenous services and an Indigenous healing garden associated with that. We're looking at outdoor seating that's related to our cafeteria. We are looking at incorporating bus stops, public transit on the site. We have an education component located here with some outdoor space associated with that. Again, the cancer center and drop off for the cancer center, and our inpatient unit, again, looking at intensive landscaping around the inpatient unit so that we really have patient rooms that feel like they're in more of a garden setting and really taking advantage of that green space that's located around the perimeter. And again, parking structure and looking at our roadway leading to our loading yard. So I'll just go into a little bit more detail on that ground floor. Most of the yellow elements that you're seeing are either public services or education services. So you can see that main entrance comes through and has access to all of those yellow elements. You'll also see things like courtyards that we're trying to incorporate into the plan. And it's important for us to try and bring daylight into the plan wherever possible. These are quite large floor plates. This is a large hospital, and we recognize the importance of daylight and views in staff retention, in the visitor and patient experience. We recognize that those are quite important. So we're really working on strategies to make sure that we've got as much daylight as possible coming into the building along public pathways, looking at providing skylights down into some of these public spaces. So again, emergency department, ambulatory care services as close as possible to that main entrance, things like public washrooms, registration, and on this side we have our first floor of our cancer center that's located here, as well as that particular entrance for the cancer center. The inpatient units are located in this sort of starfish shape. One of the advantages of having the inpatient units located in this position does allow us to articulate the inpatient units to work on getting great views. And if we try to stack those on top, we can't marry up the structure between the two buildings. So we can have a really nice rectilinear structure not have any exit stairs from the inpatient units coming down through this this D&T block. So this gives us some great opportunities and some really good opportunities to get people low to the ground and really have good sight lines of landscape as well. I'm just going to pause here. Allison, is there anything that I'm obviously not able to see the Q&A in the chat while I'm doing this? Are we okay to continue? I just want to check in.
Yep, I think we're okay to continue. Somebody did ask if the slides would be shared. We will not be sharing the slides. As Dina mentioned, this is a point in time and we're sharing this information now, but they will continue to evolve and develop. So at this point, the slides will not be shared.
Okay, that's great. Sorry, I just wanted to make sure we check in and I wasn't rolling along without paying attention to what was going on in the background. So a couple of other points to make here. There is a food services area, a food court. We're also making sure that we provide good access to the exterior for that food court. And you'll notice things like the Indigenous services. It was really important for the community members who are involved in the discussion on Indigenous services to have east-facing orientation, and also provisions for a sort of curvilinear shape to the space. It's also important to keep in mind things like an auditorium for the hospital. This is a teaching center. Having an auditorium is really important as an education center. But what we're also seeing is on new hospitals that have made this provision, they're actually trying to keep the education center accessible from outside so that people don't have to come all the way into the hospital in order to use it. And that's been really effective at a number of hospitals where they've been doing testing and vaccinations over the past couple of years. So, you know, community being able to access and use this sort of space without coming all the way in. So we've actually provided a dedicated entrance for that as well. Okay, I'm going to move up to level 2 here. So our cancer center is actually 2 stories. And this also allows us to have patients who are having stem cell therapy have direct access from the inpatient unit on this level to the cancer center, which is a great benefit. We have our main hospital pharmacy. This is not a retail pharmacy. This is the main pharmacy that supports the hospital on this level. We have cardiorespiratory. We have our main diagnostic imaging here. There is a satellite diagnostic imaging that is associated with the emergency department. We have a number of other education services and administrative components here, which also function as soft space that allow us in the future to expand diagnostic imaging as needed. And again, you're seeing those elevators that allow us to segregate back of house circulation from front of house circulation all the way up through the building. Next level up, so this is our level 3. We have surgical services on this floor. We have our cardiac labs. We have a procedure unit, and we have the hospital lab. So this is supporting all of the services within the hospital. This level has our complex care unit. So this has got good adjacency to our surgical services, allowing us to not have to take patients who've just had a surgery or procedure into an elevator, but provide I for those patients.
Dina, I just wanted to add that on that last floor, the area in blue is for critical care.
Yes.
We don't have complex care at the new hospital. That's okay.
Yes, sorry. So this is people may also be familiar with the term ICU, but these are our patients who are critical care and have may have good connections, may need good connections with all of these services. So, and again, patients can be transferred from the ED up to critical care here and through these elevators without passing through a public pathway, which is also really important. So moving up to level 4, we have our maternal child services. So we have perinatal here. We've got labor and delivery rooms. We have a neonatal intensive care unit, and we have an operative birthing suite. So people who are delivering don't have to be moved to surgical services. If they need a C-section, that opportunity is right here on this floor. We also have our pediatric inpatient unit on this floor. Pediatric and maternal outpatient services are on this floor, and Ronald McDonald House accommodations are on this floor. There is also in that inpatient unit stack, we have mechanical and electrical space on this floor. And what that allows us to do is serve the inpatient tower top and bottom. So that helps us to reduce things like duct shafts, and allows us to distribute services to the inpatient units more easily. And then as we hit level 5, on top of that diagnostic and treatment stack, now we are starting to see the mechanical and electrical services for serving that portion of the building. We also have our satellite dialysis here. So this is a dialysis unit that will serve inpatients and outpatients. And again, our inpatient units continue up through the stack. And you'll also, I should have pointed out, in the perinatal area, again, we're carving out these light wells that will allow us to get as much daylight as possible around the perimeter of the building, and those skylights that I referred to that go all the way down to our main street, or that main circulation spine, continue through, and our courtyard, which runs through the cancer center, again continues through, again making sure as much as possible we're getting daylight into the space, looking for opportunities to help with wayfinding. Those can also provide opportunities for art installations as well. All of these things have great benefit to help people as they're circulating through the building. Again, just the remainder of our inpatient floors as they go up through the stack continue on. These are levels 6 through 9. And at level 9, we also are shelling in an inpatient unit for future accommodations, making sure that we're giving due consideration to that. Now, it is important, we always, we plan, and the functional program plans quite far ahead for the understood needs of the hospital and the community, but we always want to plan for future expansion. So looking at adjacent expansion to the cancer center and the other programs that are in this stack, looking for opportunities near the education area for future expansion, and also looking for future expansion that's attached to the inpatient tower. These are all really critical. We want to make sure that there's space on the site plan. We want to make sure that there's as little disruption as possible. Expanding horizontally is far less disruptive than expanding on top of a building. So we usually try to find opportunities to do this as much as we can. And finally, this is just a very diagrammatic stack of the building. So again, you can see all of those inpatient units stacking together. They have very similar room shapes and sizes so that we can use a consistent structure going all the way through. That allows us a lot more flexibility. And then our diagnostic and treatment block, which often has larger spaces that need a good amount of spacing between our structural grid so that the spaces are as flexible as possible for future change, but also accommodating all of the equipment, all of the complex services that are being provided in this location. And with that, I'm going to hand it back. But if there's any questions that that you'd like me to address now, I'm happy to. I'll go and have a look at the Q&A, and but I'll pause here.
Thanks, Dina. And thanks for the first look at these drawings. And I do want to thank everyone who's been part of this. There has been so many people at the table participating in this. And again, it's a work in progress. And it is important to remember that the drawings that you see tonight are still in draft form. The user groups may make several changes before they're submitted to the ministry in April. They may make changes before next week. We did want to invite the community in as part of the hospital's commitment to transparency and take this opportunity to share the developing plans with all of you, because all of you have been integral to the planning throughout the entire process. So tonight, as we continue this conversation, and again, we will have a chance for questions at the end, we are going to take a look at how community feedback has been incorporated into the plans that Dina just shared. And we're going to start with one of the most frequently visited areas in the hospital. Jennifer Cameron is the director of ambulatory surgery, and she's going to walk us through plans for that area.
Hi, my name is Jennifer Cameron, and I'm the Director of Ambulatory Surgery here at Windsor Regional Hospital. The programs that I oversee help prepare patients for surgery and also help them to recover after they've had an operation. Some of these clinics you'll recognize as the Fracture Clinic, Burns Plastics Clinic, Urgent Neuro Assessment, and Pre-Admission. Getting around for our patients is pretty challenging at times. Our outpatient clinics are going to be located close to the main entrance of the hospital. And the fracture clinic, for example, will be closely located to diagnostic imaging. And that'll be a big improvement from what we have now. We want to make sure that the clinic spaces are easily accommodating for patients who arrive in stretchers or wheelchairs or who may have families with them. We want the design of these rooms to be private and spacious so that the patients may receive the treatment in the rooms and not have to be shuffled between this area and that area, that the services come to them in any way that we can. My hope for when patients come to the new hospital is that they feel welcomed and that their experience is positive and that they can really see that we took their feedback to heart, we listened, and we tried to build the space that would reflect the things that they told us.
So that was Jennifer Cameron, the director of ambulatory surgery, and inpatient units are another area where we will see big changes for patients and visitors in the new hospital. And right now we're going to hear from Dr. Ian Mazzetti, who's going to share the plans that his team is working on.
Hello, I'm Dr. Ian Mazzetti. I'm Chief for the Department of Medicine. I work as an intensivist and as an internal medicine specialist. And I'm also on the planning committee for the inpatient planning for the new acute care hospital. We want the geography of the hospital, the setup of the new place to provide a state-of-the-art experience, a comfortable experience, personalized experience, one that Windsor Regional can be proud of. And one that, perhaps isn't so uncomfortable as sometimes acute medical illness can be. So I think some of the things that you'll notice about the new acute care facility, number one, all private rooms. Large space, window space where the sun can come in, space away from the hustle and bustle of the nursing station, a private place for your family to be, to stay over. All of these will be massive improvements on what we currently have at our current facilities. And one of the things that you'll for sure notice is the planners are looking at the use of natural light. I've seen overhead shots of the real estate, and they've actually planned for where the sun is going to rise, where it's going to set. They've looked at wind patterns. So really a lot of detail has gone into the design of how this hospital gets built. on the existing premises. Please know that we're working as hard as we can on your behalf to make this a hospital to be proud of, not only as someone who works in it, but someone whose family members are going to use it, someone whose friends are involved. You know, we all have to go through the healthcare experience.
That was Dr. Ian Mazzetti, a real champion for this project. And as you heard, all of the inpatient rooms will have the capacity to be private. And this is huge. It's a struggle to take care of everyone in a facility that doesn't meet modern infection control standards. COVID made that even more apparent. And the community told us through their feedback last year, you want a hospital that is built to handle future pandemics. And I want to bring Karen Riddell into the conversation now. She knows this very well. And Karen, what features are included in the new hospital to help prevent the spread of infectious diseases and viruses like COVID-19?
Yeah, absolutely. So again, good evening, everyone, and thank you for joining us tonight. I think one of the first things, and Dr. Mazzetti, of course, outlined it, and you just highlighted it. One of the most important factors in really reducing the spread of infection is the capacity for all of our inpatient rooms being private. So that makes a huge difference. Throughout the last 3 years with COVID, there was big struggles with making sure that we were able to cohort people appropriately, making sure that we weren't contributing to the spread of COVID. And when we have, you know, approximately 80% of our rooms are not private currently, that's a real challenge, and it's certainly added to, you know, the experience that we had throughout COVID. That was certainly not as good as it could be in a new building in the future with having all those private rooms. So also the thing with a private room is if you're in a bed with a roommate or multiple roommates, there is only one bathroom in that room. So again, having the capacity for all private rooms, every patient has their own private bathroom as well. And from a COVID perspective, of course, we were looking at something that was transmitted through droplet spread. But there's many other organisms, of course, that can be transmitted through other modes, whether those are antibiotic resistant organisms, gastrointestinal viruses, or bacteria. That's certainly a private bathroom will help control. And definitely when we're looking at this new hospital, we know that this hopefully was a pandemic that we're not going to see to this scope again in our lifetimes. But we will see other pandemics, whether it's an influenza pandemic or some other novel virus that might crop up in the future. And we want to be able to manage that. And the private rooms are going to be a big step towards that. So yeah, private rooms are a big factor as we move forward.
Absolutely. And the private rooms, when you see them, when you go to other new hospitals and you see how big they are and how much space you have for the individual to get up and to move around and the natural light that's in there and the staff, it'll be a huge difference to what we see now.
Yeah, absolutely. And just thinking about that space as well in our semi-private and ward rooms, some of the rooms were not able to maintain that 2-meter distancing that we all heard so much about throughout COVID. And it's very difficult too when you have family members or friends that are coming to visit. We're really restricted on the numbers that can visit at any one time just because of the size of the rooms and also not having the capacity for overnight stays. So in the new hospital, we're going to have much more room in the patient room. So it does allow for your support people to be there with you and to spend the night if needed as part of your plan of care. So that'll be very important. And then what's most important, obviously, that we're going to exceed all the best practices and Canadian health standards when it comes to infection control, but also promoting that patient experience and having your loved ones present as part of your care.
And as we saw in Stantec's drawings, all of the services from childbirth to pediatrics will be located on the same floor. And right now we're going to learn more about the design of these areas. Devin Lansbury is manager of family birthing, and she's going to kick off that conversation.
I'm Devin Lansbury. I'm the program manager for the Family Birthing Center. Here in the Family Birthing Center, we provide the baby story. So our patients come in, they can be seen during their pregnancy, they're seen during their labor and their delivery. We take care of them after they've had their baby. And then we also provide follow-up after they've gone home just to make sure everything's going in the right direction. We take every step seriously, and we love looking at what we've done well so far and where are our areas for improvement, and bringing our teams together to be able to create the very best family birthing center that we can for our community. Starting in OB triage, where patients are first seen, we're going to build on what we currently do, and we're going to have private rooms so that patients have their own privacy and confidentiality when they're coming in to be assessed by the nursing and the physician team. Then moving into the labor and delivery and the postpartum rooms, again, private rooms where there's room to have a significant other to be able to stay, room to transition our babies after delivery, and room to just stay from the time that they are admitted for labor until they're going home at discharge. We want to make sure that you're provided with some of the comforts that you would have in your own home. So having available kitchenette areas for families to utilize with water, ice, fridges to be able to bring in their own food. One of the patient journeys that we have in the family birthing is unfortunately that of loss. And we've heard from our patients that the privacy and confidentiality that we're able to provide those families, we definitely have some room for improvement. And that's one of the things that we're really taking the time to look at when we get the opportunity to build and develop this new hospital. Making sure that we take the time to create a space where these families can grieve properly.
Again, that was Devin Lansbury from Family Birthing. And Dr. Sajid Augustine is the Chief of Pediatrics and the Medical Director of the Neonatal Intensive Care Unit. He says having an NICU close to family birthing is important so that when things do go wrong, help is close by. And he's going to talk some more about the design of that area in this next video.
Hello, my name is Dr. Sajid Augustine. I'm the Chief of Pediatrics and the Medical Director of the NICU. We provide a wide gamut of services ranging from providing care to the youngest and the most preterm of babies to children up to the age of 17 years. So the big goals are to provide a stress-limiting and a safe environment for families. We asked our members in the community for their thoughts on priorities, and many said they wanted individual rooms, and that is being incorporated in the new design of the new hospital. So each baby will get their own individual rooms. It is a big change from our current NICU setup, where babies share room spaces. So one of the things that we made sure is to have family birthing center, the NICU, and the pediatric inpatient unit all on the same floor, because it makes a lot of sense, because it makes sense for the families because they see all providers on the same floor, ease of access, and there's a natural flow to it. My hope is in the new hospital, families and children have the best outcomes in a very state-of-the-art facility.
So we're going to switch gears a bit now and talk a little bit about size. We've heard throughout this conversation, this hospital is going to be big. Some may even say it's going to be mega. And the challenge for Dina and her team is to look for ways to take nearly 2 million square feet worth of hospital services and package them in a way that minimizes walking distance for visitors and staff. And Dr. Petrakis has been part of many of those conversations, looking at ways to make that happen. Dr. Petrakis, what is the planning team doing to achieve this goal?
Well, good evening, everyone. And this is a point to make that size really does matter when you're talking about our mega hospital. The functional planning team and Stantec have spent a considerable amount of time looking at patient and staff pathways into and within the new hospital. They've considered which programs and services needed to be next to each other or stacked on top of each other to provide the optimal access for patients and families and staff. One of the initial designs of the new hospital revealed a main entrance with a main hallway going north and south that was over a football field in length to reach the inpatient elevators and the inpatient units. This really did not meet our design principles. And with the work of Stantec, we managed to decrease this travel distance significantly. And this was shown in the diagram that Dina Brown showed towards the beginning of her presentation. As well, a secondary entrance was developed working with Stantec towards the end of the diagnostic and therapeutic block and in front of the inpatient units. And in this area, there would be an entrance for staff and for patients and families that needed to go to the inpatient unit or to the clinical services that were surrounding that entrance, such as the cancer center radiotherapy department. Some of these path lengths are still quite lengthy, and we're still considering how we can shorten these distances. Parking strategy is also being developed, and this is really a very important part of how patients and families and staff are going to enter the hospital. We've considered placing entrances and parking strategically next to each other so that, take for example, as Jen Cameron mentioned, if you were coming in to the ambulatory clinics for a fracture clinic appointment, your family would be able to drop you off at the main entrance, and immediately inside the main entrance, you'd have access to the ambulatory care clinic with the fracture clinic. And immediately beside the fracture clinic, we're hoping to place the satellite diagnostic imaging center so that the patient travel distances are decreased dramatically between fracture clinic and diagnostic imaging. And I'm sure for those of you who have visited the Met Campus fracture clinic, you know the long distance that you now have to travel to go from fracture clinic to X-ray and then back from X-ray to the fracture clinic, which is quite inconvenient and quite difficult for patients and families to travel. As well, there'll be drop-off areas, as Dina showed, at the front of the building, as well as at the side entrance to the patient and staff entrances to the inpatient unit. There'll also be a retail pharmacy in the main thoroughfare that patients will have the ability to drop off and pick up prescriptions relatively easily. So the goal of all this planning is to provide optimal access and the best possible wayfinding for patients and their families within the new hospital.
Absolutely. And I think that's an important point to make. And a couple people have mentioned in the comments section here that it's a wide building. But that's one of the benefits to having a property the size that we do. And the goal here is that it is a big hospital, but when you come in, you're not going to see all of it. You're going to go where you need to be. Parking is going to be close by. There will be an entrance close by for you. You will access the service that you need, maybe get a cup of coffee, maybe visit the retail pharmacy and leave without ever seeing most of this hospital, unless you want to check it out. Some might want to check out the new facility when we move in. But that is the goal, and interesting, right? Being part of the planning tables, looking at these journeys.
Absolutely. The areas are strategically planned so that you will visit you will park and enter the building at the area that you need to go to. And the majority of the visits to the hospital are day type visits or single visits, so that the parking will be placed appropriately, as will the entrances.
Thanks. Now, two of the largest areas in the facility are the emergency department and the cancer center. Both of these are located easy to access on the main floor. And right now we're going to hear from individuals who have been at the planning table in these areas, starting with emergency.
Hi, my name is Dr. Snezhna Ninkovich, and I'm Chief of Emergency Services for Windsor Regional Hospital. Our priority is to design an emergency department that allows us to provide excellent patient care, where our services are accessible by the people who come to our emergency department, that's comfortable for our patients during their journey within the hospital organization. We will have two sites, a downtown core urgent care as well as a state-of-the-art emergency department. We're very confident that these two facilities will be able to service the advanced healthcare needs of our community. Both sites will be staffed by qualified emergency physicians, giving patients a wide variety of options for care. Well, we heard from our patients that they want to be comfortable not walking long distances to access services. As a result, our emergency department is displayed prominently in front of the building for accessibility. Our services that we normally interact with, such as ICU, CCU, the cath lab, diagnostic imaging, are all located within close proximity to allow for quick access for our patients and for good care. We've also ensured that things like cafeteria or food services are easily accessible so that the patient's course of care and stay is comfortable, and they do have access to those important things like a coffee break or a snack. The emergency department can be a very chaotic and busy place. What we've made sure to ensure was that there was designated treatment areas for a specialty populations such as our pediatrics population, patients with mental health needs, as well as patients who are less severely injured or having minor critical illnesses within the department.
That was Dr. Ninkovich, Chief of Emergency Services. And now we're going to hear from Diane Marley. She is one of several members of the hospital's Patient and Family Advisory Committee involved in the planning, and she's going to speak about the new cancer center.
I'm Diane Marley, and I am the co-chair of the Patient and Family Advisory Committee. Our goals are to take the very best parts of this current cancer center that we love, and there's so many parts of this cancer center that we love, and use those elements in the new cancer center. Their needs, their current needs, the things that they're going to need right away, their labs, their appointments where they need to go, will be as user-friendly as we can possibly make them. So the cancer center is going to be conveniently located at the front of the hospital with its own entrances, convenient parking, as well as a covered walkway. There are many elements that are designed for privacy. They'll all be laid out in their own little compartment. My hope for the patients who arrive at the new cancer center is that they will feel welcomed, they will feel comfortable, they will feel the whole experience of we care.
And Diane is a constant voice at the table. Dina and her team know the voice well, and she's always saying, what are you doing about natural light in this area? How can we get more natural light into the cancer center? We have to have more natural light. Very important. The community said that many times in all of the forums where we've had those conversations. And you heard Diane talking about it there. I want to bring Jeff into the conversation now. I want to talk more about what is being done to create that warm, positive, healing environment.
Yeah,
Jeff.
thanks, Allison. And I think Diane really said it best when she said it really begins on arrival. And it's about having that accessible parking, having covered entryways for easy in and out access. You just want to really be accessible to the building. And I think Dina showed those entry points today where we're really trying to bring that access to people immediately on arrival. We want to include bright lobbies that are open and welcoming and bring in that natural light. And we're looking at putting volunteer kiosks in each of the entries to give that kind of wayfinding support, that welcoming presence on arrival. Natural light has come up repeatedly, and it's so important in the building. Every patient room will have a window that gives sufficient natural light. And we've seen some creative ways of how the architects bring light into the rooms. There's strategically placed courtyards you'll see throughout the design that Dina showed that bring light into some of the inner heart of the building that you never thought could get light. We're planning welcoming healing spaces for visitors, patients, and staff across a number of areas. For example, we've worked with the user group dedicated to spiritual care to build quiet areas for reflection within the building that are non-denominational and supportive of everyone. We've worked with our Indigenous services partners to develop healing spaces that are culturally appropriate. Outdoor courtyards to allow for more relaxed healing experience and kind of those who want that active lifestyle to get out and have somewhere to go. Within clinical areas, we're looking at having 24/7 access for family lounges that have, showers, kitchenettes, things that support families and visitors that need that extra support. And that's on top of all these private rooms have ability for family to spend the night in the room. There is a designated family space with a bed function there that allows you to be in the room and support your loved ones. So, that's some of the feedback we're getting. And some of the common feedback we received also throughout the planning process is really about connectivity. So really it's about looking at our IS strategy and making sure that we have proper wireless signal and everybody has access to a good Wi-Fi and no matter where you are in the building, because that's really important to people. And people have brought that up a lot about the ability to use their devices in the hospital. So it's really about creating a warm healing environment, Alison, that's the center of most of the decisions we've made here throughout the planning process to date.
Thanks, Jeff. And it's interesting what you say about the connectivity and the Wi-Fi. When we did the survey and asked the public what are their priorities, one of the top words that came up when we were just starting to analyze that was charge. And I couldn't figure out why is charge such an important word in the new hospital. And everybody wanted to make sure there's a spot to charge their phone. And it makes sense when you come into the hospital, you're already feeling not your best, you're feeling disconnected, and you want to be able to have the opportunity to stay connected and keep that with you while you're here. So that's a very good point. I want to go now to Dr. Wasim Saad. He is Chief of Staff at Windsor Regional Hospital, and he says the new facility will be a game changer as well when it comes to education and research in the region.
Hi, I'm Dr. Wasim Saad. I'm the Chief of Staff and Vice President of Medical Affairs at Windsor Regional Hospital. Windsor Regional Hospital is the 7th largest community teaching hospital in Ontario. So we have been working very closely with our community partners, with the University of Windsor, with St. Clair College, and of course with the Schulich School of Medicine and Dentistry, where most of our students and residents come from. We've been working closely with them throughout the planning process to ensure that their needs and their wants are going to be met. The new hospital is going to create a welcoming space for students and residents, and this will be done through a variety of different avenues or options, you can say. We will have an auditorium that's going to be able to seat up to 250 people. We're really excited about our simulation lab, we're calling it, where you can have hands-on training without actually dealing with patients directly. We know that creating a learning environment with a simulation lab will actually enhance learning and is a driver for recruitment, not just for people who are already in practice, but those learners and residents who want to start a practice and want to start a professional career, because they know they're going to get the best training possible in that simulation environment. In addition to the learning spaces and environment that we're going to have in the campus itself, we are working collaboratively with the University of Windsor to create a health innovation park. So we're exploring all of the options that we have. I cannot understate the impact that furthering education and research in our hospital is going to have on the ability to recruit new talent to our community.
So that was Dr. Wasim Saad, Chief of Staff. And I just love all the passion that all of the user group co-chairs who we've heard tonight bring to the conversation. And Jeff, I want to pick up a little bit on what he was saying there, because in addition to all of the learners that we have within the hospital, we also have, 4,100 plus staff and professional staff who work here. So what is being done to create a healthy workspace for them in the new hospital?
That's a great question, Allison. And I know Dr. Saad talked about a lot of the stuff that's developing, and people will appreciate that. But staff spend so much time in the hospital. It's so important that we try to make their shifts as comfortable as possible. And sometimes it's the little things that make that comfort go a long way. So at the new site, an important thing is we're looking at 100% on-site parking. So gone will be the days where staff have to park a few blocks away at a parking lot and take a shuttle into work. All of their parking will be on site, which sounds small, but it's a very advantageous thing for a lot of people. It's inconvenient sometimes to take a shuttle. Locker rooms have come up repeatedly. It's been a very important topic of conversation with the staff, and we've looked at strategically placing them in clinical areas and to make sure people have that safety and security of locking up their personal belongings and having those staff lounges attached to them so they can take their quiet breaks and get some of that respite on their shift to help them throughout the day. We also heard about the importance of creating designated learner spaces. So we have so many students training in the hospital. Dr. Saad touched on it. We've created their own separate locker room. So there's a locker room for clinical students, there's a locker room for professional staff, and that really helps everyone because the staff currently in our current model, they share a lot of the frontline staff areas, and those become crowded and overused. And it's giving everybody now their appropriate space and ability to conduct their work more efficiently. There's been some careful deliberation regarding the proper placement of on-call rooms even. A lot of discussion with our physician group around on-call rooms and where should we put them, ensuring they are in safe, kind of quiet areas, off the beaten path, for lack of a better term, just so that people can get their rest and they're not disturbed on a main corridor. So we've moved those around quite a bit to make sure that they are as friendly as can be for our professional staff. Staff and learners will also have access to education spaces like Dr. Saad touched on with the Health Resource Library, a sim lab, where they can really practice realistic scenarios, which will be a huge help to their practice going forward. I guess the last thing I'd mention is there will be significantly more retail options available, which is a huge thing for our staff when they get more food and beverage options throughout their day. What those will be decided at a later date. It's too early to say that now, but there will be more space for them to integrate more options for staff throughout to take their breaks, or for patients and visitors as well to enjoy when they're at the hospital. So those are some of the design elements we're focusing on at this stage, and we'll continue to kind of investigate ways that we can make it more staff friendly as we go forward.
Allison, sorry, Allison, I just wanted to add perhaps to that a couple of points. I think I wanted to make a comment about the Health Innovation Park, or the HIP, as it's commonly known to most of us. There was a question in the chat about research opportunities in conjunction with the University of Windsor, and that's where that will be located, hopefully within the Health Innovation Park, as well as in conjunction with the University of Windsor. There are other research opportunities in conjunction with the Cancer Center that we're also looking forward to. And in terms of the sim lab, we're hopefully going to have a state-of-the-art sim lab that will have mannequins that are, again, state-of-the-art, as well as virtual simulation that will attract and provide education for not only healthcare professionals, but also for a variety of other students that will come in, as well as medical educators. That will hopefully be a big draw for them to come to the area.
Thanks, Dr. Petrakis. And that really is an exciting conversation when you start to look at the future of education and research. And I'm really excited about that part in front of the building where they have that 250 seat auditorium, and really to think about the potential that that has for the conversations that can happen there and the learning opportunities and the community events that we can have there. So right now, I want to turn to some of the questions. They've been coming in feverishly throughout this conversation, which is great. Really happy to have so many, everyone engaged here. And I know I have to give a shout out to our panelists here who have been typing in as many answers as possible as we go along to make sure that we get all of them covered. But some of them I think we'll address live as well for the benefit of everybody. We have a lot here. So in no particular order here, I'm just going to start at the top of my screen with a question for Dina. Nicholas wants to know, will there be more accessible parking spaces at the new hospital?
Yeah, it's a great question. It's absolutely essential for any healthcare facility. So the municipality will designate a number of accessible parking spaces that are required, but I can tell you that it's never enough. So as we look at our parking and transportation study, we virtually in every health facility provide above and beyond the number that's required by the municipality, because there's a recognition that the people who are coming to a hospital, there's going to be additional need above what is typically required. We also really look at the strategic positioning of those barrier-free spaces, making sure that they're as close as possible to entrances, having good access to walkways that will lead to entrances. So it's critically important, and it's something that in our next stage of design, as we do the detailed parking planning, is absolutely a consideration.
Thanks, Dina. And my next question is for Karen. I just want to make sure, because I know she got kicked out earlier. Karen, are you there?
Yes, I'm here.
Okay, Karen is here. And this question, I think, is going to cover off a lot of the questions that we've received tonight that start with how many. So a lot of people want to know, how many beds are we going to have? How many in each of the different services? What can you tell us about that?
Yeah, so basically, when we're looking at how many beds we're going to have in the future space, it's a bit early to say how many exactly, because we have to have approval from the ministry. So when we're doing the functional planning, we're looking at predicted volumes and layouts and kind of bigger blocks for the program. So how many overall critical care beds, how many overall medical and surgical beds. But the breakdown of what services will be provided in each block of those beds is not yet determined. So that's detailed work that we'll do in the next stages. But we are working actively with the ministry. So I know that there was a question in the chat as well, just around how many beds we currently have. So we have 624 acute care beds between our two sites. And what we can say is that we won't have less than that in the new hospital. And in fact, we will have additional space that will be shelled in, quote unquote, and ready for future expansion. So right now we're based in our two sites, we're landlocked, and there isn't really any more room to expand. Every nook and cranny we've been using over the last 3 years in particular. So this new space is going to give us much more growth potential. And of course, I think there was a question as well when we were with regards to the space and how small the patient care area or inpatient care areas look in comparison to the rest of the building. And I'm not sure, Deanna, if you want to highlight just the actual, when we're looking at kind of how big the inpatient area is. It's difficult to tell on the drawings, just to give a sense to the audience how big that space actually is, maybe by football field, for example.
Right. I think it may actually just be better to almost explain that, there's a there's a kind of efficiency around how many beds you have in each inpatient unit. This is something that's been considered from a lean perspective, how best to staff an inpatient unit. So typically, the beds are arranged in pods, which have all of the services that, support them, things like med rooms, soiled and clean utility rooms. And we also want to make sure that we've got, we've talked a lot about making sure that we've got private rooms with access to the perimeter. So the shape of inpatient units is really based on putting single bedrooms side by side so that they all have access to that perimeter, or that sort of star shape that I showed you during the planning review. So, inpatient units can be 12-bed pods, it can be 18-bed pods, and generally you try to get those sort of sharing with one another so staff can back each other up. We want to make sure that we're limiting travel distance for staff to get to each of those support spaces. So again, centralizing them in the middle of the bedroom spaces, and then making sure that we've got inpatient units that are also back to back, which allows us to really efficiently service them, so that we've got service elevators so that food can be distributed, supplies can be distributed. So there's really a kind of finite limitation to how many beds we'd want to put on each floor.
We've spent so much time with Dina in the virtual world today. She's losing her voice here. I do have another question for you, Dina, though. This one's about acoustics and how will noise infiltration be addressed, especially from the airport?
Yeah, it's a great question. We've done projects that are adjacent to trains. We've done projects where we have to consider factories that are nearby. So as we develop the requirements for the building envelope, there's a number of things that come into play. We want to consider sustainability. This is a building everybody wants to function really well and sustainably for its lifespan, which is quite extensive. And those attributes that give it a really good, well-designed building envelope that will consider energy can also be used to consider acoustics, making sure that, seals around windows, the extent of how many is it triple glazing that may be needed. But we have acoustics engineers that are part of our team. They'll be studying all the sort of sources of noise that are outside of the hospital, which facades of the building may require more acoustic protection, but they also look at the building from within too, and making sure that noise that's within the building, keeping patient rooms nice and quiet as much as possible, so that infiltration of sound coming into the building as well as sound coming out of the building too is all really given due consideration. So as we finalize the layout and we look at all those sources of noise, that's how we strategically plan all of the strategies that will help address acoustics and sound penetration into the building.
Thanks, Dina. And I'll give you a break. I won't ask you the next question because that was kind of rude of me to point that out and then throw you more there. Let's see. We have a question about, can you, my screen just slipped. Can you talk more about the Indigenous Services Center that we saw at the front of the building? I'm going to start that conversation and then I'll throw it over to Jeff, who's been at the table for that. But that is one of the really exciting features that we have in the new hospital. It's well documented that Indigenous and First Nations communities haven't always been well served in hospitals, and there are many reasons for that. But it was important when we started this project to work with the community to make sure that this is a hospital where our Indigenous and First Nations visitors and patients really do feel welcome. And to do that, we approached the London District's Chiefs Council, and each community between here and London very generously is giving of their time with a representative on the Indigenous Services Planning team. So they've been at the table, as well as representatives from the Can-Am Indian Friendship Center and SOHAC, and I apologize, I can't remember off the top of my head what that acronym stands for. But together they've come up with a plan that's really exciting, I think, and it includes that piece that you saw at the front of the building. Dina mentioned it is facing east, it is circular in nature. And really that was driven by the community. It's a place where Indigenous ceremonies can take place, including smudges, cedar baths. There's access to an outdoor healing space. And the conversations that have happened in this group have been really, really powerful and have led to what you saw here today. And Jeff, sorry, I got so excited there. I just threw it all out there. Do you have anything to add to that?
Yeah, the excitement goes quickly. You summed it all up. SOHAC is the Southwest Ontario Aboriginal Health Access Center. So I'll add that piece in for you. No, it's been great. We couldn't have done it without our community partners. Looking at it is creating an appropriate, culturally appropriate place is so important. So we've got a lot of great feedback around what the community needs. And I think you summed up a lot of the key points of making sure that we have an appropriate space for healing that is supportive to patients and families from the Indigenous community. You summed it all up, Allison, very well.
Thanks, Jeff. Well, I have another question here then for you. This one from Stephanie. As a trans woman and advocate for the LGBTQIA+ community, my question is concerning the washroom facilities. Has the physical design component included gender inclusive washroom facilities?
Absolutely. So it is universal access is an important part of the functional program, and it's included in there. So there is male, female, and all gender washrooms within the hospital.
Thanks, Jeff. And we had a couple of questions about the radiation treatment delivery. How do we ensure that radiation from that area won't become a health and safety issue for workers maintaining the courtyard or in other areas? I know, Karen, you addressed that. Maybe Dina, you can as well, if you want to both touch on that.
Sure. I mean, radiation protection is absolutely essential. We are required when building any elements like the bunkers to give that due consideration. There's very specific materials that we use. This has been evolving over time. There's now some great materials that have been used for radiation treatment centers like lead bricks, where we don't have to build the concrete walls quite as thick as they are in the earliest versions of these bunkers. So we have to consider where the path of the radiation, looking at how people enter and exit from them, so within the space, but absolutely from the exterior of the space, underneath and on top. So that all has to be very much part of the design. It will all be part of the design requirements for contractors building this. And this is all really covered by the regulations that ensure that when these spaces are approved, they are built appropriately.
Thanks, Dina. I'm just looking at some of the questions that we were sent earlier by email as well. And one is about, where did they go? It was about pediatric services. And we did mention during this conversation that there will be a separate waiting space in the emergency area. Dr. Petrakis, can you address what other features are included in this design for the youngest patients?
Well, initially, when patients come to emerge triage, all patients will be triaged rapidly to be able to go to their separate areas, which includes the PEDS area. The PEDS area will be incorporated within the emergency department. There won't be a separate, in quotes, emergency department for pediatrics, but will be incorporated for flexibility within the department. As well, there would be rapid access for the PEDS patients that have to be admitted up to the pediatrics floor. There'll be as well, there was a question in the chat about, are we planning a multi-sensory room? And this is in the plans as well.
Thanks, Dr. Petrakis. And another question for you, will there be a mental health and addictions facility?
There will be emergency mental health assessment, and that's the current plan. Inpatient mental health services are currently planned for Hotel Duke Grace Hospital.
Thanks. Dina, another question. There are several here, and we've touched on this, but I don't think we can touch on it enough about the wide footprint that we have. Why is it wide, and what are the benefits of that?
Yeah, I think it's important to remember this is a large hospital. We want to make sure that we've got the sufficient number of treatment rooms, all of the spaces that provide all of the accessibility, that we can provide all of the services that are needed for the community. So it's important that there are elements within the building that require horizontal adjacency with one another, so that we are not trying to actually stack things on top of one another. We had the conversation, moving patients out of surgery and out of cardiac labs, being able to move patients who are in the ED to the satellite, patients who are in the emergency department. I should not be using acronyms, to the satellite diagnostic imaging. But you'll also note, and I tried to touch on this a little bit with the inpatient units. What we really want is that flexibility for the shape of the inpatient units, to be able to maximize views, maximize daylight, really get the efficiency and the footprint. So we're placing it adjacent to the diagnostic and treatment block, again, so that we've got that really appropriate structural grid for the inpatient unit, so that we can stack washrooms one above the other and really make sure that we've got that really nice narrow footprint for the inpatient unit. Again, really working on that daylight and the very specific shape of bedrooms. And if we, for trying to achieve that shape, bringing that down on top of the diagnostic and treatment block is really complex structurally, having stairs coming through so that we can make sure that these are being built with the appropriate services and structure that work really well as part of the design. There's very different needs in the way we lay out the diagnostic and treatment components compared with the way inpatient units work. We also recognize, we've got a real opportunity here to make something feel welcoming and not necessarily feel like a skyscraper, so that it's more relevant to the community. We also really feel we've got such a great opportunity here to have inpatient units that have direct sight lines to landscape spaces. It's so rare that we can actually make that provision when we're on a really tight site. So here we've got this opportunity, especially for elderly patients. When we design hospitals that have, that are quite high, we find that a lot of our elders, we're trying to get that daylight and those sight lines into rooms, but they find this very intimidating to be up in a tower. There's something much more recognizable. There's more connections to pedestrians and community when they're a lot more visible to our elder members of our community. So we really feel that there's a great, strong number of advantages to locating the inpatient unit adjacent to the diagnostic and treatment. But again, that there are a lot of big services here, and we're really working hard through taking that bite out of the front of the building to reduce the amount of travel distance to elevators, making sure that our corridors are as short as we can make them, where people are moving through the building, getting a lot of the activity that's in and out of the hospital as close to entrances as we can, bringing an entrance as close as possible to the inpatient units for visitors who are coming to the building. But again, really trying to build something that sets a precedent for the community and is really scale appropriate as well.
And that's an opportunity that you wouldn't have on a smaller site. So we're fortunate there. And when you're talking about the views from the patient rooms, some of the hospitals that we visited as part of this planning, you need sunglasses, or when you're walking through the hospital. Some of the hospitals, we've noted that every possible place you could put a window, there is a window, and it makes such a difference. You don't really need sunglasses, and you can adjust the windows. It's not bad, but it makes such a difference. And Dr. Mazzetti has said before, in a patient's healing journey, a little bit of sunlight can make all the difference. And in the hospitals that we visited, it's a lot, and it's a notable difference. And we're going to be able to see that in this new hospital. Some of the questions that we've been looking at here have to do with, will there be a recording of this event, and will I be able to see it after the fact? Absolutely, yes, there will. It will be on our project website. As soon as it's up tomorrow, I will share that socially. And also recognizing that not everybody has access to a computer for this type of conversation. This will also be on Cogeco. And we will let everybody know at a later date when that will be available. Also, if anybody has any additional thoughts or questions that you didn't share here, please feel free to visit our website. There's an area there where you can ask questions, and also send any thoughts or feedback at any time to newhospital@wrh.on.ca. Every time people share information through that, it gets shared with our planning team. So please continue to share your input. And also, if anybody's watching now and they want to do it again and you speak French, we've got another town hall planned in French this coming Thursday at 7 o'clock. Let me just look down. I know we've been answering a lot of the questions. I want to make sure. Did I miss anything? We've talked about how it will be PEDS friendly. Dina, I don't know if there's anything you want to add about different features that can be built in to make a hospital friendly for the youngest visitors.
Well, and I think, there's a lot of features that interestingly work well for seniors and work really well for kids and families. Thinking about, again, those internal acoustics, looking at, what's at the low level of buildings. We've worked on projects like we've worked on a number of pediatric projects, but thinking about color, thinking about materials, thinking about artwork, and as well as daylight opportunities for discovery in spaces, really thinking about, even the height of reception desks when you're coming into a pediatric outpatient space can really make a difference for a lot of kids who feel that things are approachable, that they have good visibility. So there's some great strategies that we can take. A lot of it have to do with interior design. We've got great interior design, healthcare interior design specialists on our team who worked on a lot of pediatric projects. And I think, looking at the kinds of materials that are being used in those spaces, and again, things like color can have a big impact. Things like playful lighting that is still very, gives due consideration to infection prevention and control. So, that's the kind of thing we get really excited about, and we want to jump right into that. But we're a little ways away, but I think we can really commit to writing requirements for the pediatric spaces that make sure that they're welcoming and friendly, and they will stand the test of time, and really also consider the age range that may be coming to those spaces, which it can be a real part of that challenge too.
Thanks, Dina. Last question here, and this one's been asked several times. So what happens next? So before we conclude the conversation, I do want to address that. The teams are still working. They're still revising the plans. There's one more set of meetings to look at the final plans, share any additional feedback. After they're complete and approved and submitted to the ministry, the planning team will turn the attention to the tendering process to select a company to complete the design and build the hospital. And that is expected to begin in 2025, early 2025. And that was announced in the recent market update, the November market update from Infrastructure Ontario. Then with a successful bidder in place, we are looking at groundbreaking in 2026. So a lot to look forward to, and still a lot of work to do before then. And we are committed to keeping you updated throughout. So I want to thank everybody who joined us tonight, all of our panel guests. Thank you for all the work you're doing and for joining us tonight. Thanks to everyone who has shared feedback throughout the project. all of the community members and the elected representatives whose leadership has gotten us to this point, and all of the user group members and the hospital partners who are at the table working on the design. Together We Build is the motto for this project, and this really has been a community effort. Your voice baked right into the vision and the design of the project, and it has guided the team through this stage. So thank you, and we will continue to keep you updated as the project evolves. Again, please visit our website, the project website, windsorhospitals.ca, to learn more about the project. Subscribe to the newsletter where you will receive monthly updates, minimum monthly. We won't clog your inbox, but regular updates on the project so you can stay with us throughout this journey. So that's it for tonight. Again, we're back here on Thursday to do this all again in French, and hope you'll join us then. Good night, everyone.
Right. Thanks, everyone.